Can you cure a disc herniation? That's a loaded question. In this video, we're not only going to answer whether or not a disc herniation can be cured, we'll help you discover exactly what's going on, the best way to treat disc herniations, and what the word cure actually means so that you can get back to the life that you deserve. Please stay to the end where we uncover the biggest mistake people make when trying to deal with disc herniations. Hi, I'm Dr. Zielonka. I am the founder of the Center for Non-Surgical Regeneration. I am the original founder of the Ottawa Sports Science Center's rehabilitation program. And I am the author of the bestseller, Low Back Pain is Not a Life Sentence. And for the past 35 years here in Ottawa, Ontario, Canada, I've been a practicing neurofunctional chiropractor where I've laid my hands on hundreds of thousands of spines. Now, if you've been suffering with disc herniations or disc bulges or disc prolapses or sequestrations or any of these terms, then this is a video that you want to watch. You most likely have been suffering with some debilitating pain. Some people can get by with their disc herniations, but there are a lot of people who are not just falling through the cracks, they're falling into these deep chasms where not only it affects your everyday life, it will definitely affect your mental health as well. Everything from despair to depression to not knowing where to go. Well, here's the thing. We understand your pain and we know how to deal with these. What you need to understand is it's not your fault. So what's actually happening with the disc herniation? So what we're looking at is when we're looking at the spine, you have a vertebrae, you should have a nice thick disc in the middle, there should be another vertebrae, and then that's going to repeat itself. Put those all together, you've made up the spine. At each different level, you can see these yellow things here, those are the nerves, and they are coming right off the spinal cord, which is inside there. And that is how your brain communicates with everything in the body. When you feel that sharp pain in the back or down the leg, that's the nerve, the same nerve that controls the bowel, the bladder, the reproductive organs. That's why if you ever lose bowel or bladder function with any type of disc herniation, that becomes emergency surgery at that point. That's what we call cauda equina syndrome. Don't even bother coming to me. You're straight off to the emergency room at the hospital. So that's what we want to see. Unfortunately, through repetitive strain, through old injuries and so forth, those discs can actually bulge out. So I don't know if you see that right there. So whether we call that a bulge, that's when the discs come out. If it's a disc herniation, that tends to be a little more severe. There are very technical terms that come with all this, but just for general knowledge here. And a prolapse, same type of thing. When we have an extrusion, what happens is understand there's two layers to the disc. So there's the outer layer that is more what we call an annular fibrosis. So it's going to be much stronger. The inner layer, the nucleus pulposus, more gel-like, more water and so forth. So if that actually extrudes through that outer layer, that then becomes an extrusion. You can even get in what's called a sequestration, where that part of the disc can actually break off and also go up and down. You don't necessarily need to know all of these things. What you should know is there's really no such thing as a slipped disc. Doctors often use this as an easy term to understand, but discs don't slip. A slipped disc would indicate that the entire disc is moving, and that doesn't happen. They're going to bulge, they're going to herniate, and so forth. Now, when that happens, obviously, because it's so close to the nerve, that can put a tremendous amount of pressure on the nerve. And when that happens, you're going to get your sharp pain. You're going to get your numbness, tingling, pins and needles. Often that's obviously going to create some inflammation. So the inflammation itself can cause problems in there. The muscles are often going to tighten up and respond to that. So then you're going to get all sorts of muscular tension as well. Not to confuse you, but there have been study after study after study that have actually shown people on MRI who had disc herniations and had no pain whatsoever. And there's been study after study after study of people that had no disc herniation but still had significant pain. Now, often then people mistake that, or some health professionals mistake that, saying, well, the disc herniation is not causing the problem. That's not true. The disc herniation, in a lot of cases, is causing the exact problem. It's going to be dependent. The fact that you don't have a disc herniation doesn't make you exempt from all the other things that cause back pain. And you can have a disc herniation. It may simply be, in your particular case, that bulge or herniation is not pressing the nerve that is yet creating pain for you. Doesn't mean that it's not creating dysfunction for you as well. Having said all that, can these things be cured? What I'd like you to do is, if you think this is information that's important for friends and family and loved ones, please share, please hit the subscribe button, and please like. The more that people understand this, the more they can do things for themselves as well. So that brings us to the word cure. The word cure is a word that we need to handle with care, shall we say. In terms of cure, will a disc herniation ever go back to being the healthy disc that you were when you were 12 years old? Highly unlikely. Can disc herniations actually recede back in? Yes, they can. And we actually see this on pre and post MRI often in our clinic, but it's something where you need the right treatment to actually cause that to happen. That's the focus. And one of the big things that we want to talk about here is you need to identify exactly what's going on, and then you need the right treatment. Understand, we live in a real world. So again, when people think cure, sometimes they think that means it will go away and it will never come back. Well, you're going to go right back out into the real world and do a lot of the exact same things that brought it on in the first place, whether that's the chronic postures, the chronic sitting, the weakness, so many things that over time that actually created that disc herniation in the first place. And it's also a question of how resilient you are to preventing this from ever happening in the first place. Sometimes disc herniations actually come from injury and accident as well. Well, the stronger your spine was to begin with, obviously the more it can actually resist that. Now, that doesn't mean that core exercises are the answer to this either. We'll get to that in a second as well. Now that you have an understanding of what's actually going on, this is why it's so important to know the appropriate treatment to do for your disc herniation or bulge. The key thing is to get to the underlying cause of the problem. Right? Is it a disc herniation, a bulge, or prolapse? If it is, where is that putting pressure on the nerve? Are there other factors that are going on? One of the biggest mistakes we see is that no one ever gets to the underlying cause for you. So if you haven't discovered the underlying cause, then there's no way that you can actually fix that properly. And the other thing is, rarely is it a cause, it's usually causes. There's usually more than one thing going on. So sometimes we'll have people come in waving their MRI report saying, oh, I know what it is, it's an L3-4 disc herniation. And guess what? Almost guarantee you that you have more than just an L3-4 disc herniation going on in there as well. That's why a lot of treatments don't necessarily solve that problem. You may go for muscular work. You may see a therapist that's going to ease up the muscle. Well, that will give you temporary relief, but they're not fixing the actual underlying cause of the problem. You can take a painkiller and anti-inflammatory that may ease up the inflammation or the pain temporarily, but you're not fixing the actual underlying cause of the problem. There's a very simple analogy we have in here is what I call the pebble in your shoe analogy. If there's a pebble in your shoe, not to be facetious because it's very serious, you don't go take anti-pebble drugs. You don't go for open pebble shoe surgery. You take the pebble out of the shoe. You take the pressure off the nerve, whether that's the disc herniation, whatever the case may be that's putting pressure on that nerve in the first place. Now, in our clinic, we've seen some tremendous cases, one of Jeremy, 29-year-old, significant disc herniations, plus actually other things as well, stenosis and degenerative disc disease. And on MRI, pre-treatment, you could literally see how much the disc had herniated. And after treatment, you could literally see that disc reseed back in. In just a minute, we're going to tell you how we actually accomplished that. So what is the biggest mistake that we see? I've already alluded to it, is you need a proper exam, consultation and exam that gets to all of the underlying causes of your problem. Again, I can almost guarantee you that you have more than just a disc herniation or a disc bulge or a disc prolapse. For instance, that disc is part of what we call a 3-joint complex. So I can almost guarantee you that you've affected the facet joints as well. Most likely you had enough force to create that herniation. There's likely degeneration in the spine. There were things that cause that degeneration in the first place and that disc to herniate in the first place. So that means there are most likely postural imbalances or pelvic unleveling. All of these things need to be looked at. Until you do, you're going to have a hard time fixing that disc. And then once you have, again, you need treatment that's going to be specific to dealing with that disc and that nerve. You don't need muscle treatment. You don't need pain management treatment. Do those things have a role? Absolutely. But are they ever going to fix the underlying cause? They never will. In our clinic, we utilize something very specialized. There's only 12 of these systems in the world, something called non-surgical robotic laser spinal decompression. And what it does is it addresses specifically what's happening to the disc and the nerve. And it does that by creating negative pressure in that disc. It's that negative pressure that then allows decompression to happen, true decompression. This is not traction. Don't let anyone tell you that traction and decompression are the same thing. Make sure that if they claim that it's decompression, that it is in fact true decompression. Otherwise, you're not going to get the results that you're looking for. And what that does is that true decompression creates negative pressure in the disc. So negative pressure acts like that vacuum effect. That's what will pull disc herniations back in. This is very clear in the scientific literature and has been for quite some time. By pulling those disc herniations, prolapses back in, that's how you finally start to get to the results that you want and finally start getting the solutions you want for that debilitating back pain. Now, again, if you found this valuable, please share, please like, please subscribe as well. If you're someone suffering with serious disc herniation and you are in the Ottawa area or willing to travel, then your first step is to actually schedule an exam and consultation with us. Now, our next video in this 3-series video is specific to whether degenerative disc disease can be reversed.